Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, cryptococcal meningitis. Okay, cryptococcal meningitis, the causative organism for cryptococcal meningitis is Cryptococcus, which is a fungus actually. It is a fungus. Okay, so the best initial test then for the Cryptococcus meningitis is Indian ink stain of the CSF. Then, if you were asked what is the most accurate test for cryptococcal meningitis, then we can do cryptococcal antigen test can be done for detecting the cryptococcal meningitis. Then, what is the treatment of the cryptococcal meningitis? Treatment of cryptococcal meningitis is first we have neural or we have meningoencephalitis. For neural or meningoencephalitis, we can give the drug amphotericin B along with plus or minus. We can give amphotericin B with or without flucytosine is given for 2 weeks. Followed by we can also give the drug fluconazole. Fluconazole can be given orally. So amphotericin B is given plus or minus with or without flucytosine for 2 weeks, followed by fluconazole is given orally in neural or meningoencephalitis. Then we have extraneural meningoencephalitis. In extraneural meningoencephalitis, amphotericin B is given plus or minus flucytosine is given. Amphotericin plus or minus flucytosine is given for extraneural meningitis. Okay. So overall, if you were asked what is the drug of choice for cryptococcosis, the drug of choice for cryptococcosis is amphotericin B is the drug of choice for cryptococcosis.
thank you and thank you for watching.